Thank you for taking the time today to watch this video. My name is Alex Ehrlich. I am the president of Healthcare Tech IQ. And today I want to go over the introduction. Why do we create an introduction to healthcare as part of the core content? What is it that we're trying to get across that will make you better at what you do and will make you more efficient in communicating in this industry? So we hear a lot that healthcare is complex and that it's really difficult to sell in healthcare, whether it's software, whether it's instruments, whether it's monitors, whatever it is. It's a difficult field and industry to navigate. And the main reason for that really is the interdependencies and how high the stakes are when decisions are made. So those two things really make it difficult to navigate the people part of it, who needs to be at the table, and also to really get a big picture and a good picture of who is impacted by the decisions that are made and how to really assure that what we're offering resonates across all those different perspectives. So as you begin to navigate the healthcare field, there's really three perspectives that it can be summarized into. The first one being the providers. And the providers are insurance companies, whether they're public or private. The payer can be the patient themselves. The payer can be a certain charity, but really understanding the different perspectives of payers and why technology is important to them and the impact that they've had and how technology has been implemented in the last 40 years is really it's really key in seeing why having that perspective in mind as you are connecting your offering to all the solutions that we're trying to find in healthcare is pretty key. The second one is the provider. So the provider means a lot of different things. It could be a physician, it could be a hospital, it could be just a variety of people who are providing care. And this perspective is so important because it's really the boots on the ground. These are the people who are providing care in one way or another directly to the patient. And they are the ones where kind of the rubber meets the road. It's where all the decisions that get made actually get tested. And the success of that or how they fail, that's really kind of the first frontier of that. The third perspective is the patient. And while the patient was always kind of someone that healthcare happened to, it's really changed. And in the last few years, we are really seeing patients as consumers of healthcare. And this really shifted the way that we interact with them and how we see them as part of the process of developing and implementing technology. So thinking through that is really important. How is the patient impacted by those decisions? So these are all the stakeholders, and they can be summarized into one of those three buckets. And you have to think of, okay, these are all the people who are going to be impacted by the implementation of your product. And it may not be a direct impact. You may not be able to sit down and make those connections. But as a takeaway today, what I want you to think of when you think of the three Ps, the payer, the provider, and the patient, think of how does your offering impact all those personas and all those perspectives. How, and just think big picture. How does the decision to invest in what you're offering trickle down and impact that specific stakeholder? And that allows you to sit back and be able to look at a bigger picture and maybe come out with some insights as to who needs to be at the table in order to really have a better feel for how the full benefit and the full value of what you offer can be realized. So that is the action item for today. Think of the three Ps, the payer, the provider, and the patients, and think about how you offer your solution, your product, your services, whatever it is, how it impacts them. And then the next step would be think about the proportion of that impact and how can you start articulating that value for those different perspectives. And for more content like this, that's what Healthcare Tech IQ does. Our job is to give you a language to be able to communicate and to bridge that communication across all those perspectives as it relates to your solution. So for more content like this, check out our other videos and be on the lookout for our blogs and our videos and our podcasts. And we will link all those below. And thank you for your time.